Assalamualaikum BuzzBytes के ताज़ा शुमारे में आपका खैर मकदम है. Today we have an eminent face of India when it comes to the medical field, the director of Fortis Gurgaon with reference to breast oncology, Dr. Verdant Kabra ji. Sir, welcome.
Thank you.
Sir, tell us a bit about how far have we reached as far as the diagnosis of breast cancer related disease is concerned.
So the problem in breast cancer or any other cancer diagnosis in India is most of the patients come to us at a very late stage. They reach us in third and fourth stage. And if we talk of breast cancer, around 60 to 70% patients come to us in stage 3 and 4. Whereas in Western countries, more developed countries, only 20% reach in stage 3 and 4. But this has changed over the years. There was a time when it was 80% stage 3 and 4. Now it has come down to 60%. And we hope to achieve 20% for stage 3 and 4 and 80% for stage 1 and 2, where the cure rates are much higher.
How far is today's women aware about the breast cancer related diseases?
So it varies from one part to the other in country. In urban areas, they are more aware. In rural areas, they are less aware. But it's not so that in urban areas everybody is aware. There is a lot of lack of awareness even in urban areas. They may know about breast cancer, but they don't know how to detect it early, what to do for prevention, and there is a huge gap that we have to fill up.
So what are the symptoms that women should look when facing the breast cancer like severe disease?
Yeah, that's a very good question. So most common symptom is a lump in breast which is painless, which has been growing, does not cause pain usually. Maybe 10-15% patients may have pain. But remember, all breast lumps are not cancers. Around 7 out of 10 breast lumps will not be cancers, but they need to be tested. They need to be diagnosed and treated accordingly. So as I said, the most common symptom is breast lump, then nipple discharge, especially if it is bloody discharge or absolutely clear fluid. They are more indicative of breast cancer. There is thickening of the breast skin, there is nipple distortion, nipple goes inside, nipple gets deviated, or there is a dimpling of skin of the breast. These are very common and very strong signs of breast cancer which a woman should look for.
How far has the medicine advancement happened with reference to breast cancer?
Okay, so before I go to recent advances, I would also like to add that every woman after the age of 20 should examine her breast herself every month. The right time to examine is around 7 to 12 days after the periods begin, because that is the time when they can detect the lump very easily. And by this self-examination, they can find lump at an early stage. Now you are coming to your question, how far we have progressed in advancement of breast cancer treatment. It is a very ongoing process. If I look at 25 years ago when I finished my cancer surgery training, and now it has advanced by leaps and bounds. We have now better cure rates. So for example, we were able to maybe offer cure for 80 to 90% of stage 1 cancers. Now we are able to offer cure for more than 95% of them. For stage 4 disease, average lifespan would range from 12 months to maybe 28-30 months. But now, even for stage 4 disease, average lifespan can extend up to many years in a better biology disease. Even in more aggressive biology disease, we are able to give medicines and increase lifespan to almost 3 to 4 years.
Do we have pain minimizing medicines?
Yes, of course. Pain management is a very important part of cancer management, including breast cancer. In fact, at Fortis, we have a special pain and palliative care service which we involve right from the beginning. It is not only for pain management, it is not only for stage 4 management, it is also for management of the psychological disturbances that happen, not only for the patient but also for the family as a whole.
So what would be your message to the younger girls especially?
So my message is, best is prevention. So improve your lifestyle. Have a good healthy diet. Have a very good health physically as well as mentally. We must try to have full pregnancy at the right time. Do not take junk food. Do not take any artificial hormones. Feed your babies for at least a year. These are the factors which will decrease your chances of having cancer. Then next is self-awareness. You must be aware of your own breast, how it feels, what are the lumps present in your breast and how they change, so that you can detect it early if at all it happens. And if it happens to you, go to the right person at the right place, get the treatment at the earliest so that you can get the best outcome. And do not fear, fight it out, we are there with you.
Under 40 age group, is it more vulnerable to breast cancer?
In India, almost half of breast cancers occur in less than 50 years of age, which is a very disturbing statistic. In Western countries, the maximum, the peak age is around 60 years, but in India, it is less than 50 years. We are now seeing patients even in their 20s and 30s who are coming up with breast cancer.
It was a pleasure talking to you, sir.
Same here. Thank you.
Verdant Kabra ji, the head of breast oncology in Gurgaon, Delhi, Fortis, a very renowned face when it comes to the breast oncology and cancer-related paradigms. We'll be talking with him in future as well. Me, Ramiz Mogdumi with BuzzBytes. Wassalam.